Now let's cover child CPR. A few things we should be thinking about when we're talking about child CPR. The guidelines help us understand the child range is between year 1 and their first signs of puberty. There is this age, it's like 14, but there's a lot of ambiguity between when does a child become an adult and when is an adult the size of a child. I personally like to go by the size of the patient. And in this case, he is clearly somewhere between the ages of 1 and 12, which is well within our safety range of a child, and we're going to use that as our guideline for doing CPR. Secondly, when we do the depth of the compression on a child, it's 1/3 the depth of the chest. So just something to keep in mind here as we're doing CPR for the child. Now in this situation, we had a player on the soccer field and they suddenly collapsed. We don't know why. And so we're going to assess them, but we also need to think about, were they electrocuted? Did they step on a bare wire? Was there a snake? I mean, who knows? We're just going to look for anything. So ensure scene is safe. My gloves are on, my CPR shield is available, so now I'm safe to rescue. Now we're also going to be talking about what the first step is. Hand on the forehead to remind me not to move their head or neck excessively as I tap on the collarbone. Hey buddy, are you all right? Are you okay? This player does not respond. Once there is no response to my taps and shouts and I notice that they are not breathing normally, it's automatically going to be a 911 call. You in the plaid shirt, go call 911 and come back. I might need your help. And if you can find an AED, bring an AED with you. If I don't have anybody to go call 911 or get an AED, I'm going to dial 911 on my cell phone and I'm going to put it on speakerphone so that dispatchers can help coach me through this scene. Now we get right into our action. I'm going to place, in this case, for the size of the patient, 1 palm of 1 hand. If this was a large child or at the upper end of the child becoming an adult, we would treat them as an adult with 2-hand CPR. But this child is adequate with 1. I'm going to place the palm of my hand on the center of his chest, on the lower third of his sternum, between the breasts. I'm now going to start my compressions to 1/3 the depth of the chest in depth and at a rate of between 100 and 120 times per minute. That's at least 2 a second. Here we go. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. I'm going to now give a head tilt chin lift, get my mask and shield with the one-way valve, pinch the nose, and open the mouth. I'm going to give my 2 rescue breaths. 2 rescue breaths go in, I go back into my compressions. 1 and 2 and 3 and 4 and 5, 26, 27, 28, 29, 30. I now give my 2 more rescue breaths, and I'm going to do this 30 compression to 2 rescue breaths until help arrives, EMS arrives, an AED arrives, or my patient actually revives, starts breathing and moving on their own.